So if you want to start sharing your screen, perfect. Perfect. And as everyone's entering in, that's excellent. Beautiful. Welcome everyone to another webinar. You've got Callahan as host today from ShareWise. I'm joined by the beautiful Dr. Bains and CFO McGregor Grant. I'm very excited to have them today joining us on this webinar to discuss IPD. As we're talking about this today, if you've got any questions, please submit them down below. We'll get to them at the very end. But mainly for yourself, Dr. Bains, we've obviously been the Managing Director and CEO. What got you started in your venture with ImpediMed today?
Yep. So I have been the CEO of ImpediMed, started in January of this year. So now coming up to almost a year, I came to ImpediMed after 8 years at Pfizer in a number of roles, including running the Gulf cluster of countries with a background in medicine. So I think this is an exciting opportunity to really take this product, which is revolutionizing and the standard of care and creating a new standard of care for women with breast cancer-related lymphedema.
Absolutely, absolutely. And obviously, McGregor, being the CFO, there's been a few milestones that we've been trying to achieve at the moment. What's been your impact at the moment and real key milestones that you've been proud of over the last couple of years?
Well, I joined the company just over a year ago, at the end of September. In fact, it was a result of a shareholder-led change that resulted in some changes to the board and subsequently some management changes, which is at which time I joined the company as an executive. We've been in the process of addressing the cost base of the business and getting the business in better position to really maximize the opportunity associated with this BIS technology that we have initially for breast cancer-related lymphedema, but also for other indications. So it's been an interesting time of sort of turning around, resetting the business over the last 12 months.
Absolutely, absolutely. And so today, for the viewers, we are going to be going through a bit of a presentation. We'll have a bit of a questionnaire at the end. If we don't get to your questions, there will be a recording. We'll be able to send it through afterwards. But basically, we'll get started with the presentation.
Okay. So a good morning to everybody, and thank you to everyone that's joined us, and many thanks to ShareWise for the opportunity to present. So the first slide is just the prerequisite forward-looking statement that I commend you to look at as this presentation goes out, and I'll leave that with you to read more fully in your own time. So just over to the agenda for today's presentation. Today we're going to start with an overview of ImpediMed's platform technology. We'll follow this with a quick strategy recap, and then we'll run through our first application in breast cancer-related lymphedema. We'll have a look at the team that's been tasked with executing on this strategy, and as McGregor outlined, a number of us are new in the organisation, both at the board level and at the executive level. We'll cover off how we're going, and we'll look at the key metrics and Q1 results, and then finally we'll touch on ImpediMed's value proposition. So the next slide really just outlines our technology. Look, we're truly fortunate to have a platform technology. So unlike many companies that need to reinvent their next product, we're really blessed with our SOZO device being able to address multiple clinical applications. The first one being breast cancer-related lymphedema, but we can also address heart failure, renal failure, and other areas, emerging areas like venous insufficiency, protein calorie malnutrition, and many others. Not only does this technology have the ability to address these applications in the future, it already has FDA clearance and CE mark clearance for many of these clinical applications. So what does the technology do? Now, every time a patient stands on the device, you can see next to this lady in the diagram, it's a 30-second non-invasive test. SOZO takes a measurement and collects all of the necessary data for the applications that I've mentioned above in a single measurement and stores this information in the cloud. Although our initial focus is on the commercialization of breast cancer-related lymphedema, and that's what we'll spend most of our time talking about today, it shouldn't be forgotten that ImpediMed does possess this multi-application digital health platform. As outlined in the last quarterly and a number of presentations, the company's immediate strategy is to execute on break even with a focus on sales, marketing, and clinical execution. But break even is a key milestone for us towards achieving overall growth and profitability. Break even will only come through increasing sales while managing our costs. There's been a lot of time and effort that has gone into aligning the culture and executing the new strategy as we endeavour to transform this business. As McGregor outlined in the introduction, we've implemented a 10% year-on-year reduction in cash expenditure to keep our expenditure more in line with where a sales-focused startup should be. This has mostly come from changes in senior management compensation, with like-for-like executive remuneration reduced by 30%. But as we know, we're a growth business and it can't all be about costs. To reach profitability, we need to significantly increase our sales. So while reducing costs, we've actually increased our customer-facing staff by 15%, with a number of customer-facing roles now representing almost half of the business. As we walk through the presentation, you will see all the elements coming together to be successful. IPD now has an experienced board and executive team, a clear strategy and a realigned culture, all of the clinical and regulatory requirements, a growing reimbursement footprint, and the fundamental sales and marketing processes required to achieve sustainable growth. The first indication we've got is breast cancer-related lymphoedema. We have all of the elements in place for the SOZO lymphoedema measurement, LDEX, to become the new standard of care. This is a $600 million opportunity. We have a positive global randomized clinical trial that demonstrates significant reduction in lymphoedema using this technology. The technology is FDA and CE marked cleared. We have over 1,000 devices active in lymphoedema programs globally, with over 1 million tests already conducted. The SOZO and BIS technology has been endorsed by numerous industry groups and included in many guidelines. Two of the most influential of these guidelines and standards are NCCN and the most recently called the NAPBC, or the National Accreditation Program of Breast Cancer Centers. The NAPBC is a quality program of the American College of Surgeons, and the authors are leaders in US breast cancer care and are highly influential for clinicians. Standards and guidelines support clinical adoption and support payer coverage. And even more so than ever, payer coverage is a necessity as our customers face a challenging economic environment as hospital budgets in the US are stretched, with costs rising faster than revenue. I'm happy to report the US, which is our critical market, payer coverage is steadily increasing. As of today, we are now up to 23 states at what we define as critical mass, which means over 80% of covered lives in that state are covered for this technology by payers. That's up from 16 at the beginning of this quarter. So reimbursement for SOZO for US private insurers, Medicare, Medicaid, now covers 255 million lives, or 73% of the US population. There's still a way to go. We want to get all coverage, and there are a few of the largest state-based and national payers still assessing SOZO. These are very important to increasing the number of states and will bring some of the largest states above the critical mass threshold. We remain confident that we will continue to see coverage increase, as it's just so important to the survivors of breast cancer, and that SOZO measurements address this unmet need. Looking at this unmet need, it's a huge problem. For many, cancer is now seen and is a chronic disease, and improving survivorship is now important. When we looked at the US, there are 4 million breast cancer survivors just in the US alone. There's 310,000 newly diagnosed breast cancer patients. 82%, so 4 out of 5 of these patients are at risk of lymphedema in the first 5 years due to treatment. So lymphedema is effectively swelling of the limb that results from any radiation and taxane therapy or surgery on the axillary lymph nodes. The PREVENT trial, so that was a large global randomized clinical trial that we mentioned, showed that 92% of patients did not progress to chronic lymphedema when utilizing our technology for the early detection and prevention. So that was a 59% reduction over the standard of care to improve cancer survivorship. So just a little bit about this technology. So what's the current standard of care? Basically, it's a tape measure. It's used to calculate volumetric measurements. So the differences in limb volume on the arm that has had this taxane, had the chemotherapy, radiation, or surgical treatment. There are other volume-based measurements such as perimetry and water-based displacement, but tape measure is a main one. And as you can imagine, a tape measure is inaccurate, time-consuming, and readings vary from clinician to clinician. And most importantly, all of the volumetric measurements have the same issue. So this graph on the right-hand side just shows how lymphedema progresses. If you don't capture lymphedema, that subclinical phase, i.e. stage 0, the lymphedema will progress. So after stage 1 all the way through to stage 3, it is very, very difficult to treat or resolve lymphedema. So this is objective and it's fast, and it enables the early detection of lymphedema early enough at that subclinical phase so it can be resolved. And basically resolution for women at this point is putting a sleeve on the arm for a month, and that will enable rapid resolution of lymphedema. That detection at that subclinical phase is critical, and that's what the BIS technology does. In terms of, let's talk a little bit about the team setting and the new strategy. And as McGregor outlined, he started in September last year as part of a broad board change, and I started in January. So this is our new board. And the ImpediMed board really does stand out for a company of this size. You know, they are globally experienced with diverse and complementary skills. So when you think about the experiences that board members bring to ImpediMed, we have a board that have held senior positions with large corporates, including Google, IBM, and myself at Pfizer. These are some of the most successful companies in corporate history. Alongside this, we have board members that have experience with successful Australian-originated medtech companies from the early stages of their development. So these are ResMed, Polynova, and Nanosonics, companies that have successfully commercialized Australian ingenuity to the US and to the rest of the world. Collectively, this experience covers finance, sales, marketing, engineering, medical, clinical, and IT. And the board is committed to bringing all this experience together to ensure the company is positioned to maximize the commercial opportunity and value to its shareholders. And it's a similar story with the leadership team. Different skills are required to move this company from a research and development focused company to one with a commercialization, i.e. sales and marketing focus. So most of the team is relatively new, either to the leadership team or to the organization. Some of the team has been promoted from within or have taken on new roles. We've also welcomed new employees such as Tim Benkovic and McGregor Grant to ImpediMed from Nanosonics, as well as myself from Pfizer. The team have a breadth of experience and proven track record for commercialization and creating long-term value. The board has set the management team 2 initial objectives to drive the company towards cash flow break-even. 1, implementing sales and marketing processes that will grow the opportunity pipeline and accelerate our sales. 2, examine the company's cost base and ensure the long-term sustainability of the business. The team is united and focused on these objectives, and they've quickly developed a comprehensive plan to fulfill these objectives, and we are now focused on execution. So when we look at the metrics, our key forward-looking metrics are all improving and heading in the right direction. One of the keys to increasing sales starts with initiatives that drive awareness, support clinical adoption, and drive and increase lead generation. The new ImpediMed marketing team has updated customer messaging, we've revised pricing, we've initiated lead capture tools, and implemented extensive outbound marketing campaigns, media engagement, and conference schedules. This slide really highlights the effectiveness of the programs now in place to driving leads and building the opportunity pipeline. This opportunity pipeline has seen another strong increase on the prior quarter, up 34% to 585 units. Now, as I mentioned earlier, we continue to make solid headway with reimbursement coverage. As of today, we're up to 23 states with critical mass with reimbursement, with SOZO covering 73% of the US population. Pleasingly, another NCCN centre has implemented lymphedema prevention program. And as I highlighted earlier, we are very excited about the new NAPBC guidelines and opportunity that presents. In terms of the financial momentum, unit sales continue to move in the right direction. So 28 this quarter, up from 23 in the prior quarter. I like to use the term encouraging when we describe the quarter's sales. In a historical context, it's clearly an improvement on what's been produced over the last 3 years, where all but one quarter has been in the teens. But we are not happy yet. We still need to see a sizable lift in unit sales to meet our goals. We are confident we can achieve this given the processes now in place, and it remains the focus of the whole business. Another pleasing aspect of the recent quarter was a $4.8 million in TCV, or total contract value. The TCV trend had been concerning, and it's great to see a turnaround over the last few quarters. In terms of looking at the installed base and our average recurring revenue growth, we have a software as a service, or a SaaS business model. So the contracts in place as of the 30th of September 2024 are expected to generate core business annual recurring revenue, or ARR, of $11.6 million for the 12 months to 30th of September 2025. This equates to a 21% rise year on year. As I mentioned earlier, our global installed base has exceeded 1,000 devices with a very low churn rate of around 3% annualized. This is now a clean figure after we identified 78 inactive non-revenue generating units that we have retrospectively removed from our historical figures. As you would appreciate, it has taken a lot of time and required a lot of hard work to get us into this position to achieve sustainable growth. The processes are now in place. It's driving strong momentum in the forward KPIs, and results are encouraging. Our new board and executive team have all come from companies that had successful programs in place. We've taken that experience and implemented a model that we know works and have confidence that we will work here. Some of the final thoughts on the ImpediMed value proposition. ImpediMed has a market cap of around $110 million with $18.6 million in cash. We're at a product launch phase of an asset where all of the critical elements are now in place. Clinical trials, regulatory clearances, guideline inclusion all take time, and it can be easy to overlook what has been achieved and to lose sight of how uniquely placed ImpediMed is. It is a platform technology that's applicable to multiple indications, providing significant growth opportunities. It has FDA approvals, and not just in lymphedema, but also in heart failure and calorie malnutrition. It has positive results in a level 1 evidence global randomized controlled trial for lymphedema. It has multiple guidelines and industry standards, including NCCN and NAPBC, advocating its use. There is growing reimbursement, with almost half of all US states now at critical mass, or over 80% of covered lives. We have over 1,000 devices deployed globally with a very low churn rate, suggesting a high level of satisfaction with the device. And finally, a large pipeline with an opportunity value that more exceeds the company's immediate break-even target. That makes me very excited about the future of ImpediMed. Thank you.
Beautiful, beautiful. With going forward, McGregor, have we got some financials to back up this presentation as well?
No, we've really talked through the key financials already in the deck.
That's fair enough. Well, obviously, going through the proposition of the value of the company, I understand that the goal virtually is to get through to cash flow positive and growing this profitability a bit more. What has been the main focus? Obviously, sales and marketing has been a big push of recent, but how's cost cutting as well been going? What sort of avenues have we been able to cut costs?
Yep. As we've mentioned there, we have, when we joined the company, we made a number of significant changes to the cost base that has resulted in an overall 10% reduction year on year in cash expenditure from 24 to 25. And one of the stats that we quoted there was about a 30% reduction in the cost of the executive team roles on a like-for-like basis. So we've been very prudent in the way we're managing costs. We also mentioned that we just don't see that the way for success for this business will be to cut costs, at all cost. Growth in the top line is the key, as you mentioned, and the target as a sort of a stepping stone towards profitability is to get the company to cash flow break even. We often get asked, what is required to achieve that. As we mentioned, there are around 1,000 units installed globally, of which about 500 are in the US. In order to get to cash flow break even, we believe that about another 500 units needs to be sold, assuming a monthly fee of US dollars, about $1,800 a month, which is around or just under or around the price that we're getting now. Assuming that the sort of cost base remains around the same, and that the renewals of the existing contracts continue at the rate that they are with the price increases that are coming through. And as we mentioned, we have a pipeline already of close to 600 units. So we think that if we convert that pipeline, we will be on our way to getting towards cash flow break even.
So on the sales side, then, what's the sort of KPIs you've set in place? What sort of conversion are you looking to do over the next 6 months?
So we monitor our KPIs for the organisation really well and very closely. And one of the key ones is this forward-looking metrics of lead generation. And so that's the one that we are outlining to the market and showing the growth in that lead generation. And as McGregor noted, 585 units. And when you look at the total contract value of that lead gen pipeline, it probably more than is enough to cover the base, but clearly they don't all convert. So we're really looking at growing that pipeline significantly from where it is to, give that time that conversion takes. We also track our metrics such as the time to sales close very closely and indicated to the market. This is typically a very long sales cycle, so up to 6 months. And so really working on how we improve multiple levers of reducing that sales lead time. So we put a couple of kind of key forward-looking metrics. And then the key one for us is obviously executing on the sales.
So how does the device and more or less application vary to other technology out there?
Well, it's a unique, so this is a unique technology. So it's passing electrical current through the body and getting a measurement. There are other kind of BIA devices that have a lower frequency current. So ours is the 256 hertz, high frequency, more accurate. We, unlike our competitors, other parties that play in the space have FDA clearance and really target in level 1 clinical evidence in a large randomized controlled clinical trial. So really target that medical market. The technology is high trust certified, which is actually really critical when you put a technology into a hospital system where patient data is of critical importance. And so a lot of emphasis on data security. So really, and the patent and portfolio and intellectual property portfolio that sits around the technology.
Yep. Okay. And so obviously we've had the product launch phase that's been pretty good. What's the next phase that we're looking at progressing further? Obviously sales is one, but with the business model in general, what's the major push at the moment?
So the key push for us is the first goals for the organisation, which 1 to 3, which is really around increasing our sales and our breast cancer-related lymphedema indication. The US is our primary market. It generates 90% of our revenues, even though it has 50% of our installed base of devices. And so really continue to grow that market as quickly as we can. And that's where primary revenues and that's where field force team is focused. So that US sales is key, but we are also in parallel starting to work through what are those future applications and opportunities, which, as I noted, is a platform technology, multiple kind of indications. And so right now we're just going through the process of identifying what those new opportunities are and creating the business cases so we can, get this technology out to other clinical needs.
Yep, of course. And then in recent news, obviously you got that reimbursement. That was pretty important. what's going to change with the business with regards to that?
Well, reimbursement is absolutely critical. So it really drives a lot of that uptake of clinical adoption. You know, like we've already proven that the technology is clinically important for customers and meaningful, and the guidelines and NAPBC reinforce that. But we also have to recognize that it has to be financially sustainable for our customers and also for our patients. And particularly in the US market, that payer coverage is absolutely critical. So that will help both drive adoption within, you know, the smaller customers, but also in these key large IDNs or networks. So a number of these networks, we call them IDNs, are sitting across multiple states. And so getting kind of consistent coverage across states is really important to help us to kind of really get this technology up to the IDNs that, you know, we think are critical to kind of really game change adoption for this technology.
Excellent. And obviously, last year you're included in the NCCN guidelines. Can you just explain a bit more why that is so important?
Yes, absolutely. So the NCCN guidelines are a set of clinical practice guidelines that are really critical for adoption of any kind of cancer treatment, really. And so there are a very comprehensive list of guidelines that outline practices, guidelines, and standards of care, you know, multiple cancers in multiple areas. And so there's a whole specific area of the guideline under survivorship, and the BIS technology is specified within that as one of the technology options to drive lymphedema prevention. It's important for a couple of factors. One is it helps support clinical adoption. So clinicians do look at these guidelines when looking at what standard of care they're implementing for their patients. But secondly, it also helps support payer coverage. And so, you know, the healthcare payers will look at these technologies, these standards, and these guidelines to really understand whether or not this technology is increasingly becoming standard of care and is being validated by these standards. And so NCCN was really quite critical, primarily for that. And then when we look at the business a year ago, prior to the NCCN guidelines, we really had no payer coverage. So in June of last year, we had 0 covered lives. So now we've got 255 million covered lives in the US, so 73% of the population. So that, you know, these guidelines are very influential, as well as, you know, support from our clinical leads and KOLs.
So when you're focusing on your marketing and sales, are you focusing direct to those surgeons and to those medical professionals? Or are you focusing towards more those patients in general?
Yeah, it's a multi-pronged activity. So clearly the clinicians, breast cancer surgeons are really the first point of contact for patients that are coming in. So they need to, you know, we market towards them, both in terms of driving clinical awareness of the technology and also the need for early prevention of lymphedema. So what's important is when patients have got breast cancer, they need to get a baseline test. So before they go in for surgery or chemotherapy or radiation or any therapy, they need to get a baseline that says this is what your arm was before you started that treatment. And then we monitor them for up to 3 to 5 years afterwards to monitor that arm. And so that's where the surgeon is so critical to get that baseline measurement, because if you can capture them before it's clinically obvious at stage 0, then you can treat it. So if you're missing a baseline, it becomes challenging. So they are our key kind of customer. But then as you look at patients going through their journey, we also target medical oncologists, radiation oncologists, rehab therapies, and other areas. And then at the same time, in parallel, we have to do a lot of work around just driving patient awareness, right? I think a lot of women, when they are getting breast cancer or breast cancer surgery, don't often think about the survivorship and the issues at the end, right? They're just so focused on getting the immediate treatment on breast cancer. And so it's really important for us to kind of help support awareness for these patients that, look, lymphedema is one of the side effects. You know, once you go through into that survivorship journey, and most women will survive breast cancer. So survivorship is key. So we have a partnership with Susan G. Komen, so one of the key big advocacy groups in the United States, and we do a lot of work really driving advocacy and awareness.
Yeah, absolutely. So at the moment, what are the main states that have coverage?
So a large number of states, so 23, so almost half of the US. So, you know, very significant states around the United States. We don't actually put that state thing into the public domain because we don't really it's competitively competitive information. So, but we are very comfortable that we have some of the large, a number of the very large states in the US that have got critical mass coverage. So with 255 million covered lives, we've got some very large states that we're focusing on.
Absolutely, absolutely. Well, I think that's about it for all the questions that we have from everybody today. Before we end the webinar and more or less have a bit more of a chat, sorry, we just had one come in. Obviously looking around revenue at this moment, at this point in time, what are the margins, McGregor, that we're looking forward going forward on?
Yeah, it's a fairly high margin business, around 90%. So we would expect that that will continue at or around that level going forward. One of the positives that we have impacting margin is the renewals. So contracts that are renewed, generally contracts are 3 years in duration. And as those contracts renew, with the improving reimbursement landscape, the ability to increase the price on those contracts increases as well. So we've been enjoying nice price increases, and obviously that will have a positive impact on our margins overall. But we broadly speaking, we expect it to remain at or around the current level.
Excellent, excellent. Well, from both of you at the moment, obviously we've got a few large milestones ahead of us. What are you looking forward towards in comparison over the next 6 months? Is it the sort of thing where obviously cash flow positive and break even is a big one? But what are some other key milestones that you're looking forward to here?
Yeah, so my one is that key one is sales, so growth in sales and continued growth in that pipeline. So all of our forward-looking metrics continue to go in the right direction. Hopefully increasing payer coverage. So 73% of the US population is great. We'd like to get more, and so a number of couple of larger national and state payers would like to get, to see them start to cover this technology. So that would be just a critical milestone for us. There's probably the two really for us at the moment.
Okay. And yourself, McGregor?
Similar, and beyond that, obviously, the outcome of all of that will be for us to get to cash flow break even, and as I said, that will depend on the success that we have with our sales, and which will be supported by increasing payer coverage.
Perfect, perfect. Well, I think that will lead us on for today. Thank you very much, everyone, for joining us. For those new shareholders and existing shareholders, if they want to answer any more questions, how should they get in contact with you guys?
The best way would be through our investor relations at ImpediMed.com.
Beautiful, beautiful. And thank you very much all for attending the webinar today. We look forward to having you in our next one. If you missed anything or want to rewatch it, this will be up online for everyone's enjoyment. So thank you very much, Dr. Bains, and Mr. Grant. Thank you so much for having you today. It's been an absolute pleasure. I look forward to seeing you again.
Brilliant. Thank you, Lachlan. Thanks for the opportunity.
Thank you.